Hi, my name is Dr. Dan Landman, and I'm a board-certified ophthalmologist, and I specialize in cosmetic and reconstructive eyelid surgery. If you've been referred to me for a growth on your eyelid, then there's a chance that we're going to need to do a biopsy. The process for evaluating and managing your lesion involves multiple steps. Step 1 is the initial consultation. Step 2 is a prior authorization. 3 is the actual procedure itself, and then 4 is a follow-up. So for step 1, for the initial consultation, please bring your medication list and your distance glasses. If you take medications such as aspirin or baby aspirin, Advil, Motrin, ibuprofen, Aleve, naproxen, multivitamins, flaxseed oil, fish oil, or vitamin E, or blood thinners such as, again, baby aspirin, Coumadin, warfarin, Plavix, Pradaxa, Eliquis, or Xarelto, then we'll need to talk about how to stop and restart those medications before your procedure. We'll also take a photo and submit it to your insurance company, as almost all insurance companies now require prior authorization before doing the procedure. Step 2 is a prior authorization process, which can take anywhere between a few hours to a few weeks. Each insurance plan is unfortunately very different, but my staff will work aggressively to make sure that your procedure gets authorized as fast as possible. Step 3 is the procedure itself, which actually typically only takes between 5 and 30 minutes. You'll feel a small pinch and some burning, and then afterwards you won't feel anything, as the numbing medication lasts for a few hours. Depending on your lesion, I may send it to a pathologist, and the results from the pathologist sometimes take between 2 and 3 weeks for them to come back. Sometimes you might need stitches after the procedure, though I almost always use dissolvable stitches, so you don't have to worry about having your stitches taken out. I'll also prescribe an antibiotic ointment, which you should apply to the biopsy site 4 times a day for about 5 days. Step 4 is the follow-up appointment, and I typically see patients back about 1 to 4 weeks after the procedure. Whenever I do any procedure, no matter how small it is, I always tell patients that the bruising will actually be there for about 2 weeks, and the swelling might be there for about 4 to 6 weeks. So please schedule accordingly if you have a big event where everybody's going to be looking at you. Alternatively, we do know that your time is valuable, so we're actually very excited to offer telemedicine FaceTime consultations. That will save you the trouble from coming in for your initial consultation as well as the follow-up appointment. So during this medical video consultation, we'll discuss the specific risks, the benefits and alternatives to doing the surgery, as well as how to manage your medications or supplements that you might be taking. You might have specific questions, which I'll be able to answer for you right away. And I'll also be able to provide documentation to your insurance company to get prior authorization. So if you're interested in rescheduling your appointment to do a video chat, then please call my office and we'd be more than happy to help you out with that. Thanks so much.